I'm Jen. I'm a physician assistant here at Hunterdon Digestive Health Specialists with Dr. Anuba Sinha. So today I wanted to talk to you about some warning signs that we don't want you to ignore regarding colon and rectal cancer. So don't ignore these warning signs. So the first one is rectal bleeding. So a lot of times people think, they have white type rectal bleeding, but it's just hemorrhoids. And statistically it probably is, but rectal bleeding is a big red flag, a symptom. And so anytime you see rectal bleeding, we want you to come into our office and get evaluated. You may need to have a colonoscopy to take a look and to see, is it hemorrhoids or is it something else? Is it proctitis? Is it a colon or rectal cancer? So that's a big symptom. Don't ignore it. Even like women will say, oh, it's, it started after I had my kids. It's just related to pregnancy. That's a big no-no. You want to make sure you come in and get that rectal bleeding evaluated properly by a specialist. Another one is iron deficiency anemia. So if you have iron deficiency anemia and it's just being ignored, it's being blamed on heavy menses or, your diet, that's again a big no-no. So we need to rule out GI sources of blood loss. So you shouldn't be iron deficient. The only way you are losing iron is through either you're not absorbing it or through blood loss, okay? And we can't just blame it on your period either, so we need to rule out like upper GI sources of blood loss, like an ulcer, so things like colon and rectal cancers, they can slowly bleed and they can cause iron deficiency celiac disease where you're not absorbing your nutrients. That can cause iron deficiency anemia. So again, this is a big red flag symptom, not just for colon and rectal cancers, but for other GI conditions, inflammatory bowel disease, celiac disease, ulcer disease. Don't ignore that. Don't just self-treat yourself with iron over the counter. Make sure you come in. We don't want to mask, your symptoms. We want to know what is going on so we can treat you appropriately. And then abdominal pain. You're having this abdominal pain. There's no explainable cause. It's persistent. Back pain, abdominal pain. Things just don't feel right. You know your body best. Just come in, talk to us, have a consultation, get evaluated, and let's see what we need to do. Okay, so that we don't have a delay in your diagnosis, a delay in your care, and your options for treatment moving forward. So again, moving on to colon cancer awareness month this March, please come in, and talk to us about anything you're concerned about and get screened for colon and rectal cancer. Okay, beginning at 45 for all average risk adults. That's the current screening guideline. Not 50 anymore, it's 45. So come on in. We're happy to see you.